Let's talk about prenatal diet quality and how it is maintained. Proper nutrition is vitally important for pregnant people, as it affects not only themselves but also the health and development of the fetus. We'll be talking about fat and water-soluble vitamins, macro and microminerals, and fats and lipids. Let's begin with some fat-soluble vitamins. Vitamin A, which can be found in the forms of retinol, and retinoic acid, helps with reproduction and gene regulation. Too much of it can cause a birth defect called isotretinoin, while too little of it can lead to infertility and trouble conceiving. Add vitamin A to your diet by eating meat, dairy, and root vegetables. Vitamin D has the function of creating hormones like estrogen and progesterone. Consuming too much of it can lead to hypercalcemia, but a deficiency in vitamin D can lead to stunted fetal growth. Try eating foods like dairy, liver, and seafood, and keep an eye out for foods that are fortified with vitamin D. Vitamin E is essential in reducing the risks of pregnancy complications. Vitamin E toxicity can lead to an increased risk of bleeding disorders, while a deficiency can lead to infertility in both men and women. Try adding foods containing vegetable products, wheat germ, and legumes to your meals. The final fat-soluble vitamin is vitamin K, which is used in processes of bone metabolism and can inhibit the growth of cancer cells. Consuming too much vitamin K decreases the body's capacity for essential antioxidants, while a deficiency can lead to stunted growth of the fetus. Leafy green vegetables like kale and spinach are great sources of vitamin K. Adding cooked fish to your diet is a great way to include all of your essential fat-soluble vitamins. Now we'll go over some key water-soluble vitamins for prenatal care. First is folate. Maternal folic acid deficiency is linked to neural tube defects like anencephaly as seen to the right as well as spina bifida. Food sources rich in folate include leafy green vegetables, orange juice, and fortified breads and cereals. Vitamin B12 plays an important role in the growth and development of the fetus, and maternal deficiency is linked to neural tube defects like with folate deficiency, as well as low birth weight in infants. Food sources of vitamin B12 include animal and seafood products, as well as fortified breads and cereals. Vitamin B6 is great for the brain development of the fetus. Without enough B6, the baby could end up having problems with their memory. However, make sure to steer clear of B6 supplements unless recommended by your doctor, as oversupplementation can lead to health issues like loss of muscle coordination in the baby. Food sources of B6 are meat, fish, and starchy vegetables. Let's add orange juice to our plate, which is a great source of folate and vitamin C. Macrominerals are minerals our bodies need in larger amounts, which include calcium, phosphorus, magnesium, sodium, and potassium. Calcium is best known for building bones and teeth, and regulating heartbeat and muscle contractions. During pregnancy, the baby's bones are developing rapidly, and if mom isn't getting enough calcium, her body will take it from her bones to support the baby, which can raise her risk for osteoporosis later on. Phosphorus works with calcium to form strong bones and teeth, and also helps store and use energy. It's part of DNA and RNA structure, so it's important for fetal growth at the cellular level. However, too much phosphorus can interfere with calcium absorption. Magnesium supports protein building and blood sugar regulation. It can help prevent preeclampsia and preterm labor as well as support the development of the baby's bones and soft tissues. Low magnesium can lead to muscle cramps, mood swings, and complications during labor. Sodium helps control blood pressure and fluid levels. In pregnancy, sodium needs rise slightly because of increased blood volume and amniotic fluid. But excess sodium, especially from processed foods, can increase the risk of hypertension or preeclampsia. Potassium balances sodium and helps maintain proper blood pressure and heartbeat. It also supports muscle function and helps reduce leg cramps during pregnancy. Low potassium levels can cause fatigue or irregular heartbeat, while too much from supplements can be dangerous, so food sources like bananas and lentils are ideal. Let's add quinoa to our plate, which is a great source of fiber and magnesium. Now we will go over the main microminerals to include during pregnancy. Iodine is essential for maintaining thyroid health, brain health, and metabolic rate. Deficiency can contribute to ADHD, autism, or delayed development of the child. Food sources of iodine are wild-caught seafood, iodized salt, and some plants. Zinc is essential for DNA synthesis, as well as immune system functioning. Deficiency in zinc can lead to stunted growth and sexual maturity, loss of taste, and anemia in the child. Food sources of zinc include seafood, legumes, animal foods, and whole grain cereals. Selenium is essential for immune function and thyroid hormone synthesis. Deficiency can lead to cardiovascular issues, insulin resistance, and mental or psychomotor delays in the child. Food sources of selenium are seafood, animal foods, wheat-based cereals, and sunflower seeds. Chromium is essential for glucose uptake and enhancing insulin-binding receptors. Deficiency of chromium can lead to increased risk of diabetes, heart disease, and lack of tissue development. Chromium also decreases the risk of the mother developing gestational diabetes. Food sources of chromium are nuts, organ meats, cheese, and brewer's yeast. Iron is essential for oxygen transport and immune system function. Iron deficiency can lead to anemia, behavioral disorders, and delayed speech and development. Food sources of iron include beans, meats, green leafy vegetables, eggs, and enriched cereals. Let's add green beans to our plate as a good source of iodine, zinc, and iron. We will now look at fats and lipids. Phospholipids help make cell membranes and can be broken down into energy. They play an important role during pregnancy by helping the development of the fetus brain and spinal cord. Sources of phospholipids are eggs, soybeans, and fatty fishes. Cholesterol is a precursor for hormones, vitamin D, and bile. This is important during pregnancy because it is the building block of important pregnancy hormones such as estrogen, progesterone, and cortisol. Food sources of cholesterol include animal products. Triglycerides protect the internal organs and provide insulation. It's important during pregnancy because it can be used as energy so other nutrients can be sent to the fetus. Sugary foods such as candy and butter raise triglycerides while fruits and vegetables lower them. Omega-3 helps with communication between cells and also decreases inflammation. It's vital for the neurological development of the baby. The function of omega-6 is to help with cell functionality and increase inflammation. Infants that are exposed to inflammation in the body are at more risk to intraventricular hemorrhage or chronic lung disease. Let's add carrots to our plate. They help with lowering triglycerides if you have too much.